So, like, you know as well that medicine sometimes it's a really uncertain field. So, if a patient's outcome is not as expected, or it didn't turn out as you imagined, like, how do you cope with the negatives?
Yes, even the moment you choose surgery, so this is always you should get ready for this. Always, any surgeon or any doctor tries to do their best. So, want to have a best outcome, but whatever a surgeon tries, the negatives are always there.
You can't always control the
Yes.
situation.
So, especially in neurosurgery, this margin of error is very, very less. When you are operating, for example, in brain surgeries, you are operating in aneurysm, the margin of error is very less there, and you have very
Less time
to react. The moment the aneurysm ruptures when you are operating, you don't have time to react. So you should be quick enough to catch it or control the situation. Otherwise, you lose the patient on table. So there are so many situations where you have done best of the best surgery, but suddenly patient post-operatively goes bad. In brain and spine, we see sometimes you have done a very good surgery, very clean surgery.
but suddenly
Patient is not
deteriorates.
moving, patient is not getting up, patient is not moving the limbs. This happens many times. So, as a beginner, you have a lot of pressure, because if this happens in your first case or second case, you will become devastated, because you can't practice. You have all the fear that what if the next case happens like this. So this happens in many lives of a surgeon, especially neurosurgeon. Your luck should be there. That's very important, and your efforts should be there. And how you counsel the families when you are operating any patient, how well you have counseled the families and explained about the risks of surgery, the complications of surgery, and how much efforts you have put to take care not to harm the patient.